Hi, my name is Noel Tyson, and this is my presentation on human respiratory syncytial virus, commonly known as RSV. So to start, we'll just look at the objectives of this presentation. The purpose is to describe what RSV is, explain the pathophysiology of RSV, explain how the epidemiology has evolved over time and what it is currently, to look at the structure or virology of the RSV pathogen, as well as provide current treatments and preventative actions that have been taken in order to combat RSV. So to start, we'll look at what is RSV. Respiratory syncytial virus is a common respiratory infection found in both children and adults. It is more common in children, however, we are seeing a drastic rise in cases in adults, elderly, and the immunocompromised. It can vary from mild to severe cases depending on the health of the individual. Cases can be mild, resolving in a few weeks, or severe, requiring hospitalization or leads to other respiratory tract infections. So RSV is spread through the air by coughing or sneezing and can lead to serious lung infections. These lung infections can be bronchitis, pneumonia, or anything else that affects the upper or lower respiratory tract. And pathogens that are spread from coughs or sneezes can land on surfaces, which then get picked up by other people. This infection was first discovered in 1956 by scientists studying chimpanzee. The lead scientist, Morris, and his group saw this infection in a chimpanzee that they had in captivity, and several years later it was found that this virus and this pathogen is also seen in humans. So symptoms of RSV are pretty standard and are comparable to symptoms of a common cold or other respiratory tract infections. These symptoms include coughing, sneezing, fever, wheezing, generally difficult breathing, and decrease in appetite. Pretty typical. However, the severity and whether you get all or some of these symptoms very much depends on the severity of the infection. So you may not have all of them or you may not have one. It generally varies. These infection can lead to other respiratory infections, like we stated before, the bronchitis and pneumonia, and these symptoms can become even more serious in those cases. So, as we stated earlier, RSV has been more common in children. However, we are seeing more cases in adults and elderly. Um, More common in younger children just because based off of their hygiene and how often they wash their hands while they're out, touching their face or noses, other nasal passages, RSV can more easily enter their system just based off of their hygiene. It's estimated that about 87% of children have antibodies to RSV. This suggests that, or 87% before their third birthday. So this suggests that almost all children, or about 87% of them, will contract RSV prior to that third birthday. So as we stated earlier, RSV is becoming more of an issue for elderly and the adult populations. We're seeing a rise in RSV cases within those groups. Unfortunately, there's not a lot of research currently about the cases of RSV in these older populations, but I'm sure as time goes on, as cases become more frequent, we will get more data to see how comparable RSV cases is in humans in comparison, or sorry, in adults in comparison to younger children, who we have a lot of data on. And then the symptoms of RSV are pretty standard between all three of these groups. It's the same runny nose, sore throat, cough, fatigue, headache, etc., seen in children that we do see in adults and elderly patients. So next we'll look at the virology and the overall structure of the RSV pathogen. So this pathogen is an enveloped virus and it belongs to the pneumovirus genus. It's a negative sense single-stranded RNA virus that has 11 proteins and generally a large genome in comparison to the other members in its family. This makes this virus a more complex virus and means that it's more difficult to develop treatments or vaccinations in order to combat the infection. Now let's look at the pathogenesis of RSV. So RSV is a highly contagious viral infection. It's, as we stated before, an enveloped virus belonging to the genus pneumovirus as well as the family Paramoxaviridae. Infection begins through inoculation through the nose and the mouth, the nasal passages, where particles can survive several days um, in the nasal passages, or it can survive several days on the skin, the clothes, until you either wash yourself, wash your clothes, whatever it may be, or you touch those clothes and you rub your face or something like that, and the virus is able to get into your system. Continuing on to the pathogenesis, so RSV targets the respiratory tract, both the upper and the lower. It infects the ciliated epithelial cells in the respiratory tract. This signals an immune response. This immune response is widespread inflammation and the overproduction of mucus. This causes the airway to be obstructed, makes the small passageways more constrict, so the bronchioles, and can lead to those other respiratory infections such as bronchitis. The degree of this viral infection depends on the patient's health. If they have other underlying factors such as cystic fibrosis, which is a pretty severe respiratory infection or respiratory disease, cases like that where patients have underlying diseases can cause even more of a issue for their airway passages, make it more difficult to breathe, and make those symptoms even more extreme. So next, let's look at the epidemiology of RSV. So currently, RSV is the leading cause of pneumonia and bronchitis in children. It's responsible for an estimated 30 million respiratory tract infections, as well as 60,000 child deaths in the whole world. And now, if you're just looking at the United States, RSV is responsible for over 17,000 deaths per year, and this is including both adults and children. But nearly 4,000 deaths of those 17,000, so about 22%, are patients over 65 years old. So we're seeing a very good amount of the RSV deaths or RSV related deaths to be elderly patients, adult patients. And so I included this graph here, and it's just the number of RSV positive cases over the last 3 years. So we have 2019, 2020, the year of the COVID-19 pandemic, and then 2021. So we see a large drop off in the 2020 year, and this is mainly because most of those respiratory tract infections were attributed to COVID-19 and not generally just RSV. And then we see back in 2021, we see the trend going up again and starting to follow more of what was previously before COVID-19. And then we'll look at cases in 2022 of RSV. In recent months, the cases of RSV have increased very much across the US. We see places like Arizona, Oregon, Chicago, and California, they have very high cases of RSV currently. This RSV season generally starts in November, alongside the influenza season. So that may be attributable to that, but we are seeing a lot more cases of RSV this year. In Riverside County and Orange County alone, most of the ICU beds are full because of RSV cases. So we're seeing a lot more issues with RSV cases and being able to treat patients. It's estimated about 18,000 per every 100,000 cases or people have RSV. So a very high amount, and that's even shown in the graph to the side. We see that very large peak of RSV cases. This is specifically for California, but we're definitely seeing this across the United States. So general treatments for RSV, there are no defined treatment for RSV. It's pretty much treated like a general cold or general upper respiratory tract infection, where cough syrup can be used for cough reduction, getting plenty of rest, drinking fluids, staying hydrated. These are generally just tips given by physicians, medical workers to try to deal with the symptoms of RSV. There's no vaccine like you would see in influenza, and that's just indicative of how complex this virus is. Most infections will resolve by themselves within 1 to 2 weeks. However, with those more severe cases, they may require treatment in order to deal with the symptoms as well as whatever other respiratory tract infection may have came along with it. Certain medications can be given to treat the RSV or the symptoms of RSV. So if you're having a lot of trouble breathing, albuterol or other medications can be given in the form of breathing treatments or inhalers in order to try to open up those passageways that have been constricted. So general prevention that has been noted in order to try to decrease the cases of RSV, these are general hygiene tips. So it would be washing hands regularly, avoiding close contact with people who have cold-like symptoms or who are coughing and sneezing a lot, cleaning frequently touched surfaces that may have been infected with RSV or in general any other pathogen that is spread through airborne, so with sneezing and coughing, as well as hygiene for yourself, covering your coughs and sneezes to be helpful for yourself and as well as the people who are around you. Sorry. And then generally just staying home when you're sick is basic measure that should be taken in order to try to decrease the cases of RSV. And here are my references. Thank you.